Welcome. Today we'd like to discuss ethics and the relationship of medical imaging to biomedical ethics. Remember, medical imaging is part of the art of medicine, and therefore it is subject to biomedical ethics. No code of ethics provides the answers to the dilemmas faced by imaging professionals, nor is a code of ethics merely a set system of conduct. Ethics is also a personal study and investigation. The purpose of the Code of Ethics is to present a framework for a systematic examination of the beliefs that may lead the technologist to an understanding of personal and professional morality and responsibility. Radiographers interact with patients and colleagues in many different environments, from the waiting room to the surgery. They encounter a number of different situations and challenges that they must solve daily. The technologist makes decisions about how to properly exercise their professional skills and about the morality and legality of their relationships and the exercise of those skills. Contemporary professional codes of ethics are intended to serve as guidelines rather than as restrictive rules. They set forth the ideals of a profession and hold its practitioners accountable to them. One set or code of ethics is put out by the ARRT. Radiographers or people operating X-ray equipment should be knowledgeable of this code and follow the standards set forth by the code. Radiographers must be able to work in different environments and with different people, whether they be patients, colleagues, or the public. The radiologic technologist delivers care and services unrestricted by their personal concerns or attributes of the nature of the disease, such as worrying about getting COVID or Ebola or this type of thing. The radiographer provides services without discrimination, regardless of the sex, race, creed, religion, or socioeconomic status of the patient. Let's take a look at an extreme case of law and ethics. We'll look at law and ethics in death and dying. Passive euthanasia is withholding or withdrawing life-supporting systems. It is legal and ethical. Active euthanasia in most states is illegal. Acting euthanasia is administering lethal medication or giving deadly prescriptions that are and is considered illegal and unethical in most states, but you must be aware that it is legal and ethical in other states. The radiologic technologist assesses situations, exercises care, and discretion and judgment about each one of the challenges that they face, and they assume responsibility for their professional decisions and act in the best interest of the patient. Radiographers interact with a lot of people, as we've been talking, and it's very common to communicate and share things that are of interest to you or to the other person. When we communicate, we need to be aware that we are under certain standards of ethics and moral responsibility when it comes to our knowledge about patient's care and the status of patient's care. The radiologic technologists should respect confidences entrusted in the course of their professional practice. They should also respect the patient's right to privacy and not have their information revealed. This is required by ethics and law. Since you're watching this program, I assume that you know that you need to have continuing units of education that document that you are striving to improve your knowledge and skills by participating in educational and professional activities. The Advanced Health Education Center is one of the premier education centers for all types of healthcare professionals. Let's take a look at the results of a survey of physicians by specialty, and they were asked the question, would you ever perform a procedure that may not medically be warranted because of the malpractice fear? Notice that there is a large percentage of physicians that say yes, they would. And one of the top groups happens to be the radiologists. There, about 25% of the physicians polled said they would perform examinations that were not medically needed because of fear of malpractice. This becomes a challenge for the radiographer because there is a hierarchy within the hospital system between physicians and radiographers, and especially the radiologist and the radiographer. Would you go ahead and do an exam that you knew was not medically warranted because of malpractice fears for the radiologist, or would you try to discuss the need for the exam with the radiologist? Most of us would say, oh yeah, I would discuss it with the radiologist. But what's the reality of that? Usually you're so busy that you just do what you're told to do. That's why you need to assess each and every patient's request to make sure you're conforming with the ethics of your profession. In a nation where so many issues from civil rights and sexual harassment to professional negligence are decided in court, medical professionals need to be legally literate. With each ethical decision, the medical imaging professional lays the foundation for consistent, moral, and ethical professional behavior. Personal values are the basic principles an individual uses to determine what he or she believes to be right. Morals are the manners, customs, or generally accepted standards of good or right. In our discussions of basic ethics, the basic principles we'll discuss a number of times. Those principles are autonomy, beneficence, non-malfeasance, and justice. Every profession has its own set of rules and regulations. Adherence to them depends on the ethical sense of people in that profession. Ethical implications are more significant in some professions, like in the field of medicine where lives are at stake. The fundamental principle that guides the practice of medical ethics, our personal and professional sense of right and wrong, is the foundation on which we base each decision in our daily interactions. The American College of Radiology Ethics Committee serves as the industry's medical imaging highest ethical authority, and it's routinely publishing guidelines and policies to help navigate ethical situations that occur in medical imaging. A healthcare worker's professional etiquette can directly affect the patient care and change patient outcomes. You should introduce yourself, communicate effectively, and explain the procedure prior to accomplishing the exam. Common approaches to medical ethics. One is existential, which talks about the virtue of ethics. Another approach is the utilitarian approach, which looks at the consequence of ethics. You're aiming at good goal consequences, and you look at the facts and the consequences of the actions that are performed. Deontological is the duty of ethics, what the law says, and how it looks at protocols, standards, procedures, and norms. We're now going to look at the possible courses of action or a plan, and step by step how to create a course of action that is ethical. We want to look at 3 different impacts on developing a course of ethical action. 1 is virtue, 2 is action, and 3 is the consequence of the action. Which course of action could be taken, including those you would not agree with? What virtues, consequences, or duties are relevant in each of the possible courses of action? Which virtues, consequences, and duties are in danger of being neglected in each of the possible courses of action? What would each possible course of action mean for each of the key persons involved? If different underlying opinions, preferences, and worldview issues are evident, specify what they are. The next step is to determine a preferred course of action, keeping in mind virtue, action, and consequence. Dialogue with relevant parties regarding possible courses of action, discuss virtues and the consequences of the duties of each possibility of how we're going to implement the action. Use feedback to improve quality of problem solving. Develop criteria for evaluating the possible courses of action. What is acceptable? What is exemplary, and what is unacceptable? Also, we need to look at which criteria will count the most. What is the weighting for each one of the actions that we're taking? Build a convincing argument for your choice. Refer to virtues, consequences, and duties, as well as the criteria for evaluating courses of action. Seeks to reach a consensus about the preferred course of action. To do this, you can use negotiation and mediation if it is required. What protocol to follow if no consensus is received? How do we figure out what to do if we cannot reach a consensus? The next step would be obviously to deploy the plan and look at the actions as they are deployed. Make a good plan and a recourse for each of the actions. Consider implications on care plans, treatment protocols, institutional plans, and procedures. You need to determine who does what, by when, and how. Who is responsible for supervision of which part of the planned course of action? And how will the implementation of the planned course of action be evaluated? And what will the consequences be of the evaluation? Rewards or punishment or revision? Do implement the plan once this is done. Radiologic science professionals are legally liable for their actions in the daily performance of procedures and the management of their patients. Professionals must respect patient autonomy, and confidentiality must always be kept. All healthcare professionals have a responsibility to understand and practice the standards of care for their profession. Providing healthcare is a complex activity which needs many different types of professionals with different knowledge, skills, and competencies with specific roles, and there is a demand from the public for these professionals to act ethically. Laws are regulations established by the governments, be they federal, state, or local. Societal behavior is defined by laws, rules, regulations, and ordinances. Laws can be limiting and are not comprehensive in controlling all behaviors. Laws require enforcement and the authority. Laws exist so that the rights of an individual or group cannot be encroached on by another individual or group. Morals are accepted customs of living by right and proper conduct, and an individual's practice in relationship to these customs. Ethics and professionalism are fundamental in providing good radiographic practice. Radiographers, radiologic technologists, must develop and maintain an adequate knowledge of key components of the laws and regulations that affect their patients and practices. The law does not always establish positive duties to the extent that professional ethics do. The current understanding of professional ethics is based on the principles from which positive duties emerge. Ethical responsibility ultimately rests on the agent. The term agent not only refers to the doctor or technologist performing the action, but can also include the professional and regulatory framework surrounding it, and corporate and regulatory bodies that are responsible for the agents. Let's take a moment to look at the radiographer's rights. Radiographers' professional rights consist of the rights related to their expertise in radiography and their rights related to conditions that ensure their well-being. Radiographers have the right to contribute to a culture of safe radiation in their organization and to use their professional knowledge to achieve their main target, which is the safe imaging of patients. Ethical dilemmas require an ethical analysis. There are many basic ethical theories and principles, but almost all professional codes of ethics are based on beneficence, or the acting of doing good, and also on consequentialism, where decisions are based on consequences or outcomes of a specific act. Confidentiality is commonly applied to conversations between healthcare providers and patients. Legal protections prevent healthcare providers from revealing their discussions with patients, even under oath in court. Patient confidentiality is mandated in America by laws stemming from the Health Information Portability and Accountability Act, HIPAA, specifically the Privacy Rule and the various state laws, some of which are more rigorous than even HIPAA. It's clear that communication is both vitally important and potentially perilous in the practice of healthcare. Those who are guilty of gossip, thoughtless sharing of confidential information, inaccurate reporting, or incorrect medical recording often cause serious consequences for the patient as well as professional or legal problems for themselves. Medical imaging professionals, when faced with challenges, should apply professional standards and exercise personal integrity to respond correctly to the situation. A firm grounding in ethics may help imaging professionals. The defining characteristic of medicine in recent times has been its immense scientific and technological success, coupled with an iconic repositioning in public consciousness. This has been accomplished by growth in expectations from hospitals and medical institutions to a level where they are unrealistic and place undue burden on the healthcare system and those working in it. This also inevitably creates a public disappointment and anger when expectations are not met. Often conflicts are just poor communication, and what we look at with ethics is being able to resolve the conflicts. There are 5 steps that can help in the critical analysis in making an ethical decision. The very first, obviously, is to identify the problem. Then we need to develop solutions for that problem and select the best solution. Once we've selected the best solution, we need to put it to the test and sort of defend your solution based on the code of ethics. Is it ethical and moral and right? Remember to always recognize your professional limitations. Radiographers should not carry out a procedure that may be considered dangerous without first confirming instructions for the procedure with the person who authorized, the person who has made the request, satisfying themselves that the instructions contain no error. In healthcare, some common ethical issues include confidentiality, data security and technological reliability, consent, competence, interprofessional and professional patient relationships, and the organization of medical services. Unethical collection of money or healthcare frauds for Medicaid and Medicare are in the news constantly. As a healthcare professional, you should be aware of the agent or the facility or system that you are working for, because these frauds can end up causing the patient's money and you jail time. The government is looking into all forms of medical malpractice, especially in relationship with medical imaging malpractice. This often comes from inappropriate exams or too many exams being performed or the repetition of too many exams. The reason for this inappropriate imaging include patient demands, a fear of medical malpractice by the ordering physician, a lack of knowledge about when to use imaging, and incomplete clinical examinations prior to requesting an imaging study. You know, we'll get the x-rays and the lab work and then we'll figure out what's wrong. Here we see a report that was done by the Department of Justice in the year 2022. The FBI and the California Department of Insurance Fraud Division investigated this matter. The CEO of several Southern California-based medical imaging companies was sentenced today to 60 months in federal prison for running a scheme that submitted more than $250 million in fraudulent claims through the California workers' compensation system for medical services procured through bribes and kickbacks to physicians and others. Is this an unusual circumstance? Actually not. A few decades ago, when I was director of radiology in one of the hospitals here in Texas, I had a similar situation in that I had a OBGYN that was reading the preliminary ultrasound to get an accurate date of the delivery and then ordering an ultrasound later. When you order a ultrasound late in the pregnancy, you cannot be as accurate As to the delivery date, you start getting into plus and minus. This physician then did a number of C-sections, and I got a complaint from the surgery department that our ultrasounds were inaccurate, which caused these C-sections to be accomplished. As I said, I had to go back and explore this, and it was a very difficult matter to get this done, both exploring with the hospital and other healthcare professionals, including some very prominent physicians. Congress has been charged with a high-stakes, high-wire balancing act to create a bill preserving quality and access while trimming unethical and unnecessary spending. Medical image represents such a challenge, with its undeniable benefits tainted by inappropriate use. Radiographers are required to be very cautious and careful with instructions. It is especially important to follow the existing code of ethics. Every profession has its own set of rules and regulations, and adherence to them depends on the ethical sense of people in that profession. And sometimes the rules change to reflect society's current status or to reflect the evolution of the practice of medicine. Ethical implications are more significant in some professions, like in the healthcare field, where lives are actually at stake based upon our ethical decisions. Some of the things that we look at today are ethical decisions about childcare, euthanasia, medications. All of these things are decisions that we're making currently, and we use the ethical standards that we currently have to make our decision. The medical community should come together for agreement about the ethical practices of healthcare. This includes medical imaging services. Medical imaging services make up only a portion of the healthcare services that are provided. Medical imaging has an impact upon all patients, but is often overlooked as it pertains to patient care. As image acquisition times are short and rather anonymous, and the patient rarely interacts with the interpreting physician, medical imaging is not seen as a medical practice. It is merely seen as an ancillary service. The medical field often requires radiologic technologists to make complex decisions that affect patients, employers, and colleagues. Technologists must consider practice standards when making these choices, and they must act ethically to protect patient safety and respect their autonomy. The ARRT standard of ethics contains two parts: the Code of Ethics and the Rules of Ethics. Here we'll review a little bit of the workforce issues in medical imaging that impact on ethics. Medical imaging has its own culture within the healthcare, and we must be aware of the holistic healthcare culture and differences in the cultures of our coworkers and patients to optimize patient care. What are we saying here? We're saying healthcare has its own culture, nursing has its own culture, surgery has its own culture. Each area in healthcare has its own culture, and each area believes that the rest of healthcare evolves around their culture, which in fact is not true. And within our cultures, we have to look at how they're comprised, and there can be a difference in the human diversity or the different people we have that make up the culture. The workplace culture can vary from one hospital to another, one facility to another, or one country to another. and patients' interactions can vary from person to person. So there are a lot of ethical decisions that are made based upon our medical imaging workforce. There are many ways of providing health care, and research supports that clinician or disease-centered health care is less effective than a biopsychosocial system. When we're talking about biopsychosocial, we're of course including ethics and what culture is involved in providing the health care that the patient needs. The best practices for patient-centered care revolve around communication, coordination, and cooperation. The benefits of incorporating good communications, coordination, and cooperation within your healthcare practice is that there is a high rate of patient satisfaction, and there's increased adherence to care with improved outcomes. So effective care plus improved outcomes equals effective cost. So being cost effective is the cornerstone to changing healthcare environments. Let's review a flowchart of solving ethical problems. First, we must define the moral problem. Then develop courses of action to address that problem. Determine the preferred course of action from those that we have developed and deploy that course of action. Once the course of action has been deployed, we need to evaluate, did this course of action actually meet the criteria of solving the problem that we were trying to address? Many of the ethical problems we face are based upon cultural differences and philosophical differences, even religious differences. The things that we are trying to do in solving these issues is to have the patient trust us, trust our integrity, how safe we are in their treatment, how loyal we are to treating them, and how responsible we are in taking care of their health. Understanding diversity in culture is one of the many components of creating an ethical approach to patient care. Healthcare professionals play an important role in the care of families from diverse backgrounds. Achieving an improved level of cultural competence will lead to improved communication with the families and reduce disparities in health and healthcare utilization. For instance, if you have a patient coming in from the Middle East who needs a mammogram, often the husband needs to be involved in the decisions or even telling the healthcare worker what the problem is. It is a cultural difference from what we have in the United States. Or we may have different cultures that have a totally different outlook as to what is proper, what is ethical, and what is needed. We are discussing ethics and focusing on how cultural diversity can impact on the medical imaging's professional ability to perform. Remember, the patient has the final word, autonomy. If the patient says no, the answer is no. But different cultures may expect the radiographer or CT specialist or ultrasonographer to perform the exam against the patient's express consent, because it is the family that is considered the decision maker in this healthcare scenario and not the patient. So when we look at patient care, what we'll find is that there are different aspects of patient care that revolve around medical ethics, healthcare culture, and the core cultural values and beliefs of the patient and of the provider of healthcare for that patient. Cultures differ in their understanding of what causes illnesses, how illnesses should be treated, and how illnesses can be prevented. As an example, from my myopic view of Western culture, I certainly would hate to be treated in a culture that decides that whatever happens, happens, and it's a matter of fate, and we'll leave it up to nature, rather than coming in and trying to address my medical problem and fix my, or cure, not fix, my disease or trauma. To have a good relationship with people from other cultures, we need to learn to listen, respect differences, and remember that our communication style, not the content, may be the problem. For example, think about personal space. We have a personal space in Western culture or the United States where we feel comfortable. In other cultures, the personal space may not be the same. They might want to be closer or farther back. If you're talking to someone who's right up in your face, does it make you feel uncomfortable? Or if you're talking to someone who's very, very distant, does it make you feel uncomfortable? Remember, we're not changing the words, we're just changing the difference. And this is something we need to understand culturally and be respectful of. There are many aspects to culture. Radiologic technologists encounter patients from a variety of racial, ethnic, and socioeconomic backgrounds, as well as from different regional backgrounds or different regional cultures. In a pluralistic society, characterized by many different cultures, the meanings of various behaviors and practices are as diverse as the people demonstrating them. Incorrect assumptions easily lead to miscommunication. We are born into a culture and then learn how to think and behave within it. No matter where you later move to, the culture you were born into and raised in will have a lifelong influence on your values. While it's not possible to know the details about each and every culture that is represented in our workplace or community, we need to know the implications that cultural diversity poses as we provide imaging services. Cultural diversity being the differences not only with the patients, but the healthcare providers. The problem with communication is that people harbor certain beliefs, assumptions, attitudes, and values that cause them to interpret messages as they listen to the words. This may even be within the same culture. The hospital can be disorienting and frightening to people of different cultures. Successful treatment of patients requires that their beliefs concerning the causes of their illness, how the illness should be treated, and how the illness can be prevented in the future must be acknowledged. Beginning in training and throughout our careers, radiographers understand that there's a range of responsibilities that they have that are bound by existing ethical codes. A radiographer must be very careful in their work. It is essential to make sure that the procedures conducted meet the requirements and comply with the current medical standards. A good example of this is using shielding on infants. We used to have a lead shield on each and every infant that we exposed, and now we find that that has gone by the wayside because it actually caused more exposures to be done on the patients, causing a greater increase in the amount of radiation instead of decreasing radiation as it was intended to do. In addition, a radiographer must be able to communicate with the patient in order to avoid making a harm to the patient. Once a patient and a radiographer understand each other, the amount of mistakes and misconceptions will be reduced to nil. It is very, very difficult to be able to communicate in a language that is not your first language, especially in high-stress situations. We all know how to say a few common phrases in, say, Spanish or Thai or whatever, such as "Hai jai kao mak mak layut set leo, respiri profundo, eretengulo, no respiri, no resuella." These sayings get your patient to take in a deep breath, but just being able to say the words doesn't mean that you understand and communicate the message correctly. Now you talk about challenges. On one hand, it's imperative that the informed consent of the patient be obtained before the procedure is started. Performing radiography on a patient, say a trauma patient, who does not speak English or does not communicate at all, means that those patients are most likely unaware of the possible negative consequences of the examination. So to go ahead and proceed with the examination would seem unethical. At the time, it's a high-stress situation. At the time, it seems like it would be very difficult to get a translator down in time to actually make a difference in the patient's care. What is the reality of the situation? Think about the ethics here. Not all images are textbook. Not all images are perfect. We have to decide that the image is a reflection of the patient's condition at that moment in time. How are we going to best demonstrate the information that the physician needs? This may be something simple, like we need them to lie in a decubitus position for at least 10 minutes to let air rise and fluids fall before we do the examination, or something as complex as trying to position trauma patients. Now we take a look at the skill level that is documented for the operator of the equipment. What am I talking about here? We have some states that have licenses and certifications. We have some states that have certification only. And what is the difference between the different certifications? Because a certification can be for, say in Texas, a non-certified medical imaging specialist or a certified medical radiologic technologist. There are different levels. Limited license. What does this mean for our skill level? And who actually is in charge of documenting the skill level? Well, when we have a certificate, remember, a certificate is an agency that is certifying your voluntary presentation of your credentials, and they are certifying that you are skilled enough to do the exam. On the other hand, when we talk about licensure, licensure is a federal government or any type of government regulatory system that you have to meet certain standards to be able to do whatever the license says you can do. And now we look at what are the types of licenses available. So you can see, just in finding the skill level of the individuals to perform the exam, there is a variety of ethical questions that fall into the realm of what is ethical for doing medical imaging for these patients. Healthcare licenses and certificates are two distinct things. The Though the term certification may sound and feel like it's describing a government or state's approval to practice the medical profession, that's actually not the case. When we have a certification, what are the legal ramifications of a certification? Remember, it's a non-governmental certification. My mother could certify that I'm really a good person. Does it mean that I am? Not necessarily. Whereas if I have a license, I have to meet certain criteria to be able to hold that license. A license is a limited time permission that a government entity grants to practice in healthcare. It's given only after verifying that the individual meets certain standards and predetermined criteria, such as education, examination, and experience. So we're not only talking about your education and the ability to pass a test, we also have to have documented clinical experience that demonstrates that you are able to perform the test. Professional medical associations, such as the American Registry of Radiologic Technologists, don't have the authority to grant a medical license. However, they can play a pivotal role in helping an individual obtain a license by advocating on your behalf for a state license. Remember, certifications are provided by organizations and are voluntary. To get a certification, an individual must fulfill all the eligibility requirements specified by that organization. They should also undergo and qualify an assessment, written or oral examination of skills and knowledge. If you could look back many years, we used to have more than one certifying entity for medical imaging in the United States, other than just the American Registry of Radiologic Technologists. And today we have multiple MRI certification entities as well. So getting a certificate is voluntary, as they only need to add to the individual's qualifications, but they don't allow them to start to practice a job or skill. To maintain the certification for a long time, individuals are usually required to undergo continuing medical education and periodic retests and participate in regular training. The American Registry of Radiologic Technologists does not have a blanket license for all medical imaging. Rather, they have different categories of skill that they certify that you are qualified to perform. In some states, you must obtain a state license before you can work as a radiologic technologist there. That differs from the ARRT certification and registration. If you want to become certified and registered with the ARRT, you must meet our requirements and apply to the ARRT. If you want to obtain a state license, you must meet the individual state's requirements and apply directly to the state. Remember, there are other organizations for ultrasound, nuclear medicine, MRI that also certify you for a job or skill. More than 75% of states have licensing laws covering the practice of radiological technology, although each of those differ from state to state. You must obtain a state license before you can work as a radiological technologist in these states. In addition, many states use the ARRT exam scores and/or credentials when making licensing decisions. In other words, some but not all states require you to be certified and registered through the ARRT before you can obtain a state license. Keep in mind that earning an ARRT credential doesn't necessarily mean you're eligible to work in a particular state. You'll need to meet the state requirements. Again, there is a difference between licensure and certification. Ethical medical imaging professionals must possess a keen sense of the role that human values play in resolving ethical issues that arise in the professional practice in the imaging department. These issues can be in dealings with patients and the interactions with physicians and even other healthcare professionals. Radiologic science professionals are legally liable for their actions in the daily performance of procedures and management of their patients. Every profession has its own set of rules and regulations, and adherence to them depends on the ethical sense of people in that profession. And sometimes the rules change to reflect society's current status or to reflect the evolution of the practice of medicine. Ethical implications are more significant in some professions, like in the healthcare field, where lives are actually at stake based upon our ethical decisions. Some of the things that we look at today are ethical decisions about childcare, euthanasia, medications. All of these things are decisions that we're making currently, and we use the ethical standards that we currently have to make our decision.